Good morning and welcome to This Week in Cincinnati. I'm Kristen Hartman. Thank you for joining us. Today, we're speaking with Hamilton County Commissioner Chris Monzel. He is running for a third term on the commission. Monzel also served on Cincinnati City Council for 9 years before running for county-wide office. Monzel is unopposed in the GOP May primary, but two Democrats are vying in to face him in November. Mount Healthy Mayor James Wolfe and former Forest Park Mayor Stephanie Summerall Dumas. Joining us now is Commissioner Chris Monzel. I want to thank you for being here. And also joining us this morning are WCPO reporters Paula Christian and Amanda Seitz. Thank you for being here.
Thank you. Thanks for having us.
So I want to get to the laundry list of things that you guys have on your plate, that you're addressing, and it's the heroin crisis, the Western Hills Viaduct, jail overcrowding, FC Cincinnati, and there are more. If you were to take a look at all of those, what's the most important?
You know, to me, it's always been public safety. From the get-go, when you look at the taxes you're paying and how much we spend on keeping people safe in our community, it's 2/3 of our general fund budget.
Does that mean heroin then?
That's heroin and the jail capacity are the two, I believe, critical issues that we have to face as a community. And there's no easy answer, especially from the heroin perspective. There's not just one silver bullet that's going to solve all the problems. It's going to be a lot of different efforts, and we've tried that with our establishment of the Hamilton County Heroin Coalition, which we put in place 2 years ago to start working on this. And just the different angles of trying to go after drug dealers and law enforcement, trying to go after getting more treatment opportunities for those who want to get rid of that scourge of the heroin, addiction, and then also education, which I think is going to be the long-term, really program that we need to put in place with schools to work with the Prevention First folks here in Greater Cincinnati to get that out to our children to say, don't even try it. Don't even go there.
I spoke with Governor Kasich, who said we are making progress in the state of Ohio. Do you agree with him?
It is. It's incremental, and that's because it's such a huge problem right now. It's like an iceberg. We see the top of it, but it's massive underneath the water. And what we are working on is kind of chipping our way at it. It's incremental, but it's not a massive step change yet. That's going to take us some time. Okay.
How does the jail overcrowding situation affect the heroin situation, if it does? Or how does heroin affect that?
Well, from the first, I guess the first part is with the heroin crisis itself. You're getting more people who are getting arrested. Every time you see a story about somebody overdosing in a McDonald's drive-through or in a White Castle's, they sometimes have children with them, right? So immediately the child's put into foster care, which is an issue we have from the county's perspective, the rising costs for that. But then also the individuals sent down to the Justice Center. And so when you see more of these happening, those folks are going to be held in the Justice Center over time. And right now we have roughly about over 1,400 prisoners in the Justice Center. And I've been told it's roughly about 1,100 of those are there for mental health and substance abuse issues. So when you peel that back, the number that are just there for those type of issues is incredible. So from the standpoint of the heroin crisis affecting jail capacity, it's a huge driver in that. And
what do you think about the sheriff's proposal to reopen the Queensgate facility and use it potentially for those?
So I took actually a tour of the Justice Center just a few weeks back. I believe it was the end of last year, and met with the sheriff and his deputies and just the situation that they're in. And it's not a good situation. I mean, we definitely have to do something. Queensgate, from what I've been told from our administration, is not capable of bringing people in right now. That you couldn't go in there, clean it up and throw prisoners in there today.
And what's it going to take to get it up to speed?
Well, right. I think there's issues with regards to the roof that we don't know about and how much money that's going to cost. So for me, looking at Queensgate is not just a simple, hey, we can just go do it, open up the doors and put people in there tomorrow, but rather it's going to take a long-term look at trying to stabilize that building. And is that the best use of our money? Instead, should we partner with the healthcare community and providers from the Talbert houses, to the different addiction clinics that we have out there and try to get the non-violent, low, kind of offensive prisoners out of the Justice Center and utilizing those treatment facilities and being held there and partnering with them. So I think we have a lot of capacity within our healthcare network. Can we utilize that to help us in regards to opening up more capacity at our jail?
And this problem's only going to get worse for you guys later this year.
Absolutely. You're bringing up the felony 5. So there's been a restructuring at the state level where felony 5 offenders will not be going to state prison anymore, but will be sent back to the county. So we've heard numbers of between 100 to 200 new prisoners that will be coming to our Justice Center that we don't have space for right now. So we have to come up with something that's going to be not just helping from the heroin crisis, but from that felony 5 offenders coming into our community.
Not to mention the fiscal pressures that come with that, right?
Right, absolutely. Because with more prisoners in, you have more costs, more healthcare costs, you have more personnel cost of running the jail. It's just something that financially is going to be a stress on our budget.
But this isn't a new problem. I mean, jail overcrowding has been plaguing the county for over a decade. I mean, when you're going out campaigning, like how do you tell voters that anything's been done to improve this problem?
So there's a few things we're working on right now. We actually have put in a proposal with the state capital budget to get funding to expand a space within the current Justice Center that's just being utilized. There was some classroom space, some office space that we could put another up to 100 beds, pods in there for prisoners, which is a positive. And then we have another plan to look at some other parts of the Justice Center as well to probably get in maybe another 100 beds. So that's potentially up to 200 beds, which is a start, but I believe no matter how many we put in, we're going to fill it because people just want, criminals off the street, which is a good thing from a community public safety standpoint. But being able to get a holistic answer to this is going to take us some time, and I think that's where we have to partner up with some of these other agencies and the judges to say, hey, can we put some of these folks not in the Justice Center, but in a treatment program that's secure, that's out in the community, that's going to be beneficial for capacity at the Justice Center, as well as getting that person the treatment they need to get off their addiction to heroin.
But that's a whole other realm of cost as well.
Yes, yeah, absolutely. And that's where I think partnering with hopefully the state of Ohio and the federal government to try to get some of these funds to help us do these type of programs will help us from a financial side to pay for them.
We are not near done with our conversation.
Okay,
so
that's good.
We are going to go back, we're going to go to break, continue our conversation with Hamilton County Commissioner Chris Monzel in just a moment. Stay with us.